Maintaining a healthy lifestyle, it's important, but it's even more crucial if you live with diabetes. According to diabetes.org, more than 1 million people have been diagnosed in our state alone, including one Burlington woman that we spoke with. She shared with WFMY News 2's the steps that she took to help manage her diabetes.
Altheria Stokes was in her 30s when she was diagnosed with type 2 diabetes in 1998.
I had symptoms like the room was spinning, so I didn't know what was going on. And so then I told my doctor, and then she scheduled me an appointment, and then that's when I found out that I was a diabetic.
Increased urination, weight loss, and high blood sugar are other symptoms doctors say a patient can have. Stokes says she felt dizzy during that time, doctors encouraging her to make lifestyle changes.
At first I was I didn't really know how to eat once I found out I was diagnosed with diabetes. So then I did my research and everything, and then my doctor explained to me, and gave me some information on diabetes, what to eat.
Trading things like rice, potatoes, and corn for more healthier choices.
Things like baked foods, certain vegetables.
Dr. Eno Newlin, who works within Cone Health's Community Health and Wellness Center, says when a person is diagnosed with diabetes, exercise and the amount of food a person takes in is key.
How much of carbohydrate intake are you having? How much of sweets are you taking in?
Newlin says doctors push for what's called a My Plate method that consists of a 9-inch plate divided into 4 compartments.
We recommend that just 1/4 of that compartment or that section should be your carbohydrate. And then the other 1/4 would be mostly protein, and the other half, which is the 2 remaining quarters, would be mainly your fruits and your vegetables.
She says this helps toward taking the right steps as well as seeing your doctor and getting on medication. Medication is what Stokes is currently on to help manage her diabetes. She says when she was first diagnosed, she suffered from depression, but making the right lifestyle changes helped her manage her diabetes well. In fact, that's her advice to others.
Don't let diabetes get you down. You know what I'm saying? I mean, just exercise, eat right, and take your medication if you're on medication.
In Burlington, Sydney Moore, WFMY News 2.
We are going to continue the conversation and talk more about what we should know and steps to take to help control our blood sugar. Dr. Eno Newlin with Cone Health Community Health and Wellness Center is with us right now. All right, so to start, what are the health risks or the complications that could happen when blood sugar levels are unmanaged and we leave them unchecked?
When we have uncontrolled blood sugars, we can have what we call hyperglycemia, and we have complications of diabetes. And this range from the complications that affect the large vessels, like a heart attack or stroke. We call those cardiovascular disease. We could have renal failure leading to dialysis. We could have what is known as the microvascular complications, and these are complications where the vision is affected, so it's called diabetic retinopathy. We could have the nerves being affected, causing neuropathy, and people start to have numbness in their feet, and they have difficulty with the sensation. Other complications include ulcers, and then people don't feel when they step on a nail, and that could develop into a sore. And in combination with the neuropathy, this could lead to amputations if they have underlying peripheral vascular disease. And that is another complication where there is occlusion or narrowing of the blood vessels that supply the extremities.
Okay, everything you've described are things that none of us want. So we want to make sure that we manage it, that we check it. Let's talk about some common mistakes people make when trying to control their blood sugar.
One of the major mistakes I've noticed my patients making is, in an attempt to control their blood sugar, they skip meals. And that's because they want to make their blood pressure controlled, the blood sugars controlled. So instead of skipping meals, what should happen is if you're noticing that your blood sugars are still running high, you want to get in touch with your PCP. You want to make them aware that whatever regimen you're using for managing your blood sugars is not controlling your blood sugars, and they need to adjust the dose of your medications rather than skipping meals in an attempt to control your diabetes.
Okay, so no skipping meals. There's other solutions instead. Okay, let's talk a little bit about some lifestyle changes that can have really big impacts on keeping our glucose or our sugar levels in check.
So when we say lifestyle changes, it's a big word that encompasses exercise, it encompasses diet, it encompasses weight loss. And so when we talk about exercise, we're talking about 150 minutes of moderate intensity exercise, like brisk walking, that would count. And when we talk about diet, we refer to what the American Diabetes Association looks at, the My Plate method, in which if you imagine you have a 9-inch plate and you're dividing that into 4 quadrants, one of the quadrants should have your carbohydrate, that's your starches. The other should be your protein, your lean protein. And then the other 2 quarters would have your fruits and your vegetables. And then we want to go easy on things like the fats, on the desserts. Those are things that, can make the blood sugar levels high. And then we look at weight loss. Losing about 10% of one's body weight can actually reverse prediabetes and change that to become normalcy. So, smoking cessation. And so, all of these things combined together is what we refer to as lifestyle changes. And these go hand in hand with medication in ensuring that the diabetes is well controlled.
When it comes to nutrition, let's talk about, are there hidden sugars that might surprise people that they need to be aware of?
Many people go for cereals because they're healthy, and they unfortunately might not be aware of the amount of sugars in those cereals. And so it is important to ensure that when you're eating cereals, they don't have additional sugars in them. Or one is eating oatmeal. The good fashioned oatmeal is good, but then when you have those instant oatmeal packets that have been sweetened, one might think one is eating oatmeal with the fiber and it's nutritional, but then there are additional sugars that might contribute to elevating blood sugars. And then there's some fruits that have higher glycemic index, like watermelon. Watermelon does have a lot of sugar in it. And so if one is eating or consuming large amounts, that can also cause elevated blood sugar.
Okay, how about like some beverages that maybe we're not thinking about?
And we recommend that water be taken. That's the primary drink. And then, but many people are drinking lots of soda and doing diet soda instead. But we recommend going for water as the primary drink and avoiding all the sweetened beverages, because those do not help those cause elevated blood sugars.
Okay. All right, so changes in routine, traveling like we're all going to be doing next week, it can really throw off someone's regular diabetes management. So let's talk about the steps that we can take to help keep our blood sugars in check when we're traveling, when we have that change up of routine.
So the key to this is planning and preparing ahead of time. So you want to know how long you're going to be away for. You want to ensure that you've gotten adequate refills from your primary care physician and enough to last you for while you're going to be away. And if you're going to be away for a long time, you want to ensure that you have a pharmacy where you're going to be, so that medications, if you need refills, you can get them. And then you want to have a pill box so you can have your medications in there. You want to make sure that you have if you're using insulin, you have your pens with you. And then when you get there, your host has to be aware that this is the condition that you're living with, and your host does go a long way to helping you, because you are at the mercy of what is prepared at where you're going to be staying. And so if you're preparing unhealthy meals, then you're going to find that for the duration of time you're there, your blood sugars are elevated. So having these conversations and preparing well ahead of time. If you're traveling on the road, you want to have an idea of what are the healthy options. If I'm going to get fast food, what are the substitutions you can make that will not adversely affect your blood sugar?
Okay, so continuous glucose monitors getting much more popular. What should people know about them, and when should someone consider using one of them?
Do you mind repeating your question?
The continuous glucose monitors?
Yes, that has been one of the greatest developments over the last couple of years, and that is because it empowers the patient. So you have it right in your hand, and with the newer models, one is able to see the real-time blood sugar. You don't have to wait to have to prick your finger. And so that helps you know the effect of whatever snack or meal you're taking is having on your blood sugar. So that helps you make an informed decision. So you know, if I'm eating this cup of yogurt, this is what's happening to my blood sugar. And then there are other things like you're going to work out. Right after working out, there's metabolism of the glucose and it speeds up. And so the glucometer is able to tell you, oh, your blood sugar is on its way down and you know to take a snack rather than waiting until then having low blood sugar. The continuous glucose monitor also has alarms. And so if the blood sugar drops in what we refer to as hypoglycemia, it does sound an alarm and it does wake patients up from their sleep. And so that's a tool that empowers the patient and helps the patient make good lifestyle decisions and lifestyle choices. And so like some of these meters even give you an average of your blood sugar over 3 months called A1C, which is helpful for you to know.
Gotcha. Okay. And it helps that you don't have to prick your finger. That monitor just does it all right there for you.
Yes.
Thank you so much for your time and your expertise. If you missed any of this is going to be in the 2-year well-being section of our website of WFNYnews2.com.